Well, welcome again to the Hack My Age podcast. I want to give you a little reminder to please go rate and review the podcast. I know I ask you a million times to do this. Thank you to those of you who've already done it, but it is really a small gesture that makes a really big impact for us. We're trying to grow the podcast, and it's only those reviews that help bump us up and get noticed. And we need to support a podcast that has interests in menopause and helps give women a voice in this space. Another reminder is please join the Biohacking membership, Menopause membership group. It's growing. It's fun. There's so much interaction in there. We absolutely love it. It's a safe space to share your thoughts, to get information. We're having a giveaway this month of April. It's Nuchido. It's a supplement that we're going to talk a little bit about in this episode, and it helps us improve our NAD levels. And I am a fan. I take it myself, and I get great feedback. And just like Primeadine, which was our giveaway last month, I get great feedback, and I'm just a big fan and believer in these products because I know they work and I know they're safe. And these women who we're going to meet today have a lot of integrity. So you're going to be very excited to win that bottle of Nuchido if you can sign up to the membership before May 1st. Okay, it's for those members who are in the group for the month of April. I'm really glad that you tuned in today. This is a very important episode about supplements and what actually goes on behind closed doors from two very well-respected formulators. And this is Dr. Nichola Conlon and Leslie Kenny. Both have been guests on the Hack My Age podcast multiple times. Links to those episodes are going to be in the show notes too, because we may refer to them as we go along. And I'll give you a little background on Dr. Nichola Conlon. She is an amazing molecular biologist. She got her PhD in physiology from Newcastle University, which is home to the largest institute for aging research in Europe. She's also a trained cosmetic scientist. We did a great podcast on what goes behind the scenes in the skincare industry. And I'll have a link to that in the show notes too. And she's got years of experience in molecular biology, particularly when she was working for a huge biotech company looking at early stage drug discovery. And she then used this experience to create her own company called Nuchido to bring a supercharged scientific discovery. She brings products and education to the public. And Dr. Conlon, she's really passionate about educating women. She wants to empower us so that we can make the best decisions for ourselves. And that's the whole purpose of this podcast. Now, Leslie Kenny, she is a native of Southern California, just like me, and she lives in Oxford in the UK. She's a certified health coach with the Institute for Integrative Nutrition, and she was in the first cohort of Dave Asprey's Bulletproof training. This is the whole biohacking space, if you are into that. And she's a great patient advocate, and she's graduated from Harvard and Berkeley. She's become a sexologist and now is the founder of Oxford Healthspan, which is a nutraceutical company promoting a healthier, longer life for everyone. And Oxford Healthspan is also the maker of my all-time favorite supplement, Primeadine, spermidine, which we're going to hear about too in this episode. And these really are two of my biohacking besties who have come to know over the years through both friends and their businesses. And if you've been following me for more than a minute, you know I'm a big fan of Leslie's Primeadine and Dr. Conlon's Nuchido. And the reason I can talk about these products so easily is just because I not only get the great feedback from you, the listener, the follower, but also because I've dug really deep into these women and their businesses to know that they have the most important ingredient in their products, and that's integrity. And not everybody's got that. And they have integrity, and they don't cut corners to make a bigger profit. They can, maybe they should, but they know how to do it like the big boys, but they won't. And that's one reason why we're all seeing great results with their products. And when I meet with these women, and I met them in person several times, we discuss the supplement industry. And And what they both have told me about, it raises a lot of questions and a lot of doubts. And our conversations really are so mind-blowing that I have to share it with you. And so that's why I decided to invite them both on at the same time, to empower you with what you need to know about supplements and what's going on behind closed doors. So it's a great honor to welcome to the show Dr. Nichola Conlon and Leslie Kenny. Welcome.
Hi,
Hey there,
Zora.
I I want to first share a little bit more about you both to the audience, because I had read the intro, and I why did you decide to get into the supplement business? So let's start with Dr. Conlon.
Yeah, so my background is, well, I'm a scientist, first of all, but my background prior to getting into the supplement industry was actually in drug development, which is quite unusual for someone to go from the world of pharmaceuticals to then go into the world of supplements. But I'd say one thing I noticed, but actually there were two things that really bothered me within within the drugs industry, sorry. And that was that there was a lot of incredible science happening, but because of the sort of red tape and, extremely lengthy timelines of drug development, it meant that all of this cool science takes a very, very long time to actually get into the hands of people that can benefit from it. So as a scientist, that's always really frustrating to know that we're working on things that aren't going to reach an end person for about 15 years, which is just quite crazy when you think it's that long. And the second thing that was a bit troublesome to me was that a lot of the molecules that we were testing that worked really, really well were not your typical drug candidate molecules. They were actually molecules that were quite well known, things that were natural molecules that were found in, foods, nutrients, things that were already regulated as dietary supplements. But unfortunately, the world of pharmaceuticals is obviously not interested in them because they cannot patent them. And if they can't patent something, then they can't own it. And commercially makes perfect sense. But for me, ethically, I was like, hang on a minute. We have really good molecules that are already known to be safe, that have excellent efficacy and could be actually helping people now. They don't need to be drugs. Why are we not doing something with this? So I set up my company, which is Nuchido Laboratories, in 2017. And my vision was, let's do something with all these other molecules that drugs companies aren't interested in, but could potentially be really beneficial, and, get things out to consumers within the supplement market much quicker so we can start benefiting from this science, really.
Yeah, your story just blew my mind when we had our first recording, and this is why you have such a deep knowledge, not only in the supplement industry, but the drug industry as well. And I'm so glad you made that shift, and it makes perfect sense. I can see your positioning, like, why are we doing this? And we can help so many people with so many other things too. Not that drugs are bad. I mean, we need drugs for certain things,
Yeah.
but if we can do things a little bit with fewer side effects or none at all, why not? And I think that's
Yeah,
one of the main things. So, and Leslie,
I agree.
yeah, we've done so many podcasts together with both of you, and so and just for those people who haven't listened to those yet, I'll have all them in the show notes. But Leslie, you also have an interesting story of how you got into the supplement industry. Let's share just briefly how you even got there.
Well, unlike Nichola, I'm not a scientist, but I'm a patient. So I come at it from the end user perspective. And having been diagnosed with multiple autoimmune conditions and been put on immune suppressants and told that with one of my illnesses, lupus, there was nothing that could be done, I was able to, using lifestyle factors and some other science, I was able to reverse my autoimmune conditions. So what struck me was the fact that doctors and other clinicians seemed completely unaware of the ability to use these molecules that Nicola refers to that are commonly found in foods to act as anti-inflammatories in the body, to help the immune system reset, rebalance. And it angered me as a patient to be deprived of the option of accessing these molecules. And here in Oxford, where I live, I'd been working with Oxford Science Innovation, which is the university's spin-out group, and then Oxford Science Enterprises, which is a big fund, helping regenerative medicine companies raise money. But they weren't interested in these non-patentable molecules that Nichola talks about, because without a patent, as Nichola said, you can't own or control the revenue streams, the future revenue streams of a particular molecule. As a patient, I don't care about that. I want what works, plain and simple. And I especially want what works that has no side effects, because I can tell you that if you are taking immune suppressants, you're told right away that you're not allowed to be in very crowded social situations. So think movie theaters, children's parties, birthday parties, where you might be exposed to pathogens that your body can no longer defend against. And while those drugs have a role to play, this is not a way, at least in my opinion as a patient, I did not want to live my life having to avoid the things in life that I loved doing, which was being with other people and sharing, special moments with them. But then there were these anti-inflammatories that actually were able to help my immune system not overreact. And I just thought, why do we not know about these things? So that's how I got into the industry, really from the perspective of a patient advocate who was a bit outraged that it was not easy to get these things.
It's unbelievable. And I really encourage people to go listen to your other podcasts. You haven't only just been on mine. You both of you have been on multiple podcasts, and it's so empowering to hear both of you. And I did a great podcast actually with Leslie discussing what buyers need to be aware of when looking for a good spermidine supplement, because that's what you're all about, the spermidine and Primeadine. So this episode is in the show notes, so don't worry. But Leslie, why don't you just briefly explain what is going on in the spermidine world, and maybe even start with like, what is spermidine anyways, for those people who have not been following me more than a minute.
Okay, so spermidine is part of a class of molecules called polyamines. That just means that they're made from multiple amino acids. You know, people take collagen, that's amino acid. So it's not so scary to take a polyamine. Spermidine was named after the fact that its presence is in semen. And unfortunately, the die was cast hundreds of years ago when a Dutch biologist, Van Leeuwenhoek, saw a dried crystal under a microscope and just called it spermine. He didn't know what it was. Fast forward a few hundred years, they find another molecule there called spermidine. Now, a lot of research has been done on polyamines, but it wasn't until recently that we realized that it has some very powerful effects as an activator of something called autophagy, however you want to pronounce it. It simply means in Greek, self-eating. And this is the cell's way of cleaning out debris, creating some energy as it burns up that debris and taking recycled parts to make new shiny cells for the body. And when we're young, we manufacture it in plentiful amounts in our tissues. We manufacture it in our gut biome, and then we get it also from plants, primarily plants. And it is so crucial to the survival of the next generation in our species and in other mammals that it is in abundant quantities in breast milk. So not just semen, but also in breast milk. It's also in high quantities in the endosperm of all seeds. Again, this is what the seed needs to grow. So you can understand its importance. As we get older, spermidine production in our tissues goes down, just like we don't produce as much melatonin, progesterone, estrogen, testosterone, just goes down. And depending on our gut biome's exposure to, say, broad spectrum antibiotics or infection with competing bacteria like Candida or H. pylori, the healthy colonies of bacteria in the gut biome that can manufacture spermidine may be compromised. Now, if you're lucky and you eat a lot of plants with fiber, prebiotic fiber to feed those bacteria, you may be as lucky as the healthy centenarians in the longevity hotspots of the world, like Okinawa and Sardinia and Ikaria. And these folks have very good production of spermidine as they get older. But most of us have been exposed to the standard American SAD diet, and all that processed food, all the broad spectrum antibiotics mean that our biome, our gut biome, does not produce it in the same amount as before and as we need. So we need to get it from plants in order to activate that self-renewal, that cellular self-renewal process. Luckily, you can supplement if you need to kind of top up your reserves. And there are times in your life when you might not have, or you might deplete your store cupboards of spermidine. So when a woman has a baby, she's basically giving the baby a lot of her spermidine to help it grow, both in utero and then in breast milk. And that's why also, because spermidine helps with hair growth, that's why a lot of women postnatally find they lose their hair. It's due to loss of spermidine and loss of thyroid hormone. And then say you've had an infection, a viral or bacterial infection, to fight that off with, say, a virus like COVID, the body uses something called virophagy, which is basically the bagging up of viruses and burning them up, getting rid of them, just like it would the trash in the cell. And you need spermidine to do that. So that's kind of what it does and why it's important.
So you've created this supplement, it's Primeadine, and if anybody's been following me for a while, they know that I'm just such a huge fan because I get a lot of feedback. Not only just a great thing, but people tell me the benefits that they're feeling and they're seeing, not let alone what they're not seeing. They can't tell me that. But we do have a lot of great research on spermidine. But we've done this podcast. It was incredible what you told me about what's happening in the spermidine industry. And I think it's reflective of what's happening in the supplement industry in general. And it's similar to what Dr. Nichola has been telling me as well. And I really want to bring this out in the open so that we can empower our listeners with what we need to know in terms of making the right choices when it comes to supplements. So tell us what you've found out that's been going on in this spermidine industry, because I think it's important to know.
Yeah, and I want to say that I think Dr. Conlon will have similar stories because we're both dealing with hot molecules, as it were. And whenever you have something that's hot, everybody jumps on the bandwagon and you get copycats and people cut corners because they see it's a way to make a fast buck. So what's happening in particular with spermidine is that the research, there is no clinical, that means research in humans using synthetic spermidine in humans to show effectiveness or safety. Not yet. Maybe they'll come in the future, but we don't know this yet. And what we do know is that you can use, to a certain extent, you can use a synthetic version, which is very, very cheap to make. And factories in China are churning this out like crazy, just like they are the NAD supplements as well. And the synthetic version has been used with animals, just like thalidomide was tested in rodents and was shown to be safe. But unfortunately, as we later found out to our detriment, thalidomide was not safe in all humans. And as a matter of fact, led to a decade of children born with severe birth defects. Now, as a patient, I really don't like the idea of taking any kind of a non-natural supplement that has not been tested for safety or efficacy in humans yet. I understand that you need to start with proof in animals first. I get that, but this has not yet been shown to be the case in humans. Now, in the food supply, we know we can get it from certain sources that have higher amounts. So that would be like shiitake mushrooms or natto, which is fermented soybeans.
Mhm.
And as a manufacturer of spermidine supplements, I know I can get it from chlorella And I can also get it from highly concentrated wheat germ. But there again, you want to get quality. Now, what I've been seeing happening in the industry is that as soon as spermidine became hot, a lot of Chinese companies began to spring up, and they were making this, and it cost literally pennies per kilo. Now, when they sell it to someone, obviously it sounds better if you're a manufacturer to say, I will sell you more for less, right? Everybody's a value shopper. But is more always better? And there was a study that came out in Nature Aging in October of 2023, which showed that with rats, with rodents and fertility, if you gave them some synthetic spermidine, it helped with fertility. But if you gave them too much, it impaired female fertility. So the question is, what is the Goldilocks zone? And my fear is that it's going to be a bit like rapamycin. And I've talked to lots of people who've taken rapamycin who say, oh yeah, this works great. I didn't notice anything. And other people who said, yeah, I took a little too much. And then I got all these open mouth sores. So where is that right amount when it comes to a synthetic with not just humans, but with men and women, with people of different ages who metabolize these molecules differently as they get older, generally metabolize less well. Ethnicity, does that matter? What about gut biome? That would have an impact too. So there are all of these factors that make me nervous with the synthetic spermidine products. And Nichola can talk more about this because I know she knows so much more about this than I do. But the other thing that I've been seeing with spermidine is that because people like me and Nichola have said, hey, these natural molecules as they occur in nature are so much more powerful than the synthetic, some people have actually said, well, right, what's the workaround to get a quote unquote natural product from a food-derived source? And they've been taking buckwheat seeds or wheat germ or rice bran, and they dump it into a giant vat with lots of water, and they pour in bags of synthetic spermidine. So these seeds sprout. And as they sprout and grow, they suck up, those roots suck up the synthetic spermidine, and then they dry them and they powder them and they say, oh, look, we have buckwheat sprouts or barley sprouts or rice bran sprouts with high concentrations of spermidine. Well, guess what? That's almost entirely going to be synthetic spermidine. Probably 99% will be synthetic spermidine. And we've tested so many different competitor products back in Japan, and we can see in every single instance these high synthetic quantities, and they have none of the other polyamines that help with the polyamine recycling loop that is so important for the body to have. Because another co-occurring polyamine, spermine, together with spermidine is important for bone health. It's important for prostate health in men, but we're just ignoring that if we get just the synthetic. So
this is amazing. And it's shocking. And we don't know, like you said, we don't know how many it's in terms of quantity, as well as if the synthetic is doing more harm than good, or if it's doing more good than harm. We just don't know. And so you're really taking a risk with this, and people are being fooled into thinking that it's a better product and it's cheaper. Do you think the manufacturers know this when they say the buckwheat and they go, oh, it's natural? Are they aware that this is not going to produce the same, well, we don't know if it's going to produce the same effects, but that that hasn't been tested, that could be putting the buyers at risk?
it's a gray area. And in the European Union, certainly the sprouting practice has now been made illegal. So you can't do this anymore. But I was approached by one of these sellers who wanted to dispose of their stores. So they were allowed by the EU courts to sell off what they had already made. But they were told they could not make any more. So what happens then? Oh, well, then the Chinese stuff in, right? And I am half Chinese, so I don't feel like, I'm sort of saying something nasty here. about, the Chinese as a people. It's just this practice it tends to happen in China, unfortunately, and a huge number of these raw materials come from China. And honestly, the policing of those materials is very poor.
Well, this is why I really recommend only Primeadine, spermidine, because I was unaware of these things, and I'm sure most people aren't. Dr. Nichola, what are you seeing the same thing? I mean, this is people cutting corners to make a bigger profit, and I understand why they want to do it. In your industry, this is the NAD industry. So maybe you can also briefly explain what Nuchido does and why you've created this, and what are you seeing in the industry in terms of, I don't know if there's copycats or people trying to make a bigger buck.
Yeah, I think first, just to build on something Leslie was saying, there's a reason why synthetic versions have to go into animal testing first. And that's because we have no clue what is going to happen in humans. So this is what the process happens. They make it go in animals first, and then eventually it will go into humans. But the beauty of natural molecules is that they have been tested in humans for thousands and thousands of years. And that means you can bypass animals because, we don't want to be testing on animals. And you can actually go straight into doing trials on humans because we already have a very, very good idea of the safety, the toxicity, the tolerability levels. So again, that's just another reason why, although synthetic versions are cheaper and they're cutting corners, they are just not the best route to go down if you want something that is safe, and actually that a company maybe knows something about, rather than just putting these molecules into humans that literally nobody knows how they're going to work. So I think that's just an important point to say. And the other thing is that, I completely agree with you, Leslie, especially within the longevity space. You often see these really popular or hot molecules suddenly come out where it's like, this is the latest molecule. Everyone needs to be taking it. Have you heard about it? You'll see all sorts of things on social media and, clickbait and certainly spermidine's been one of them. The other one is absolutely NAD. This is something, it's a molecule that I have worked on for the last 10 years, but over the last 2 years, I'd say it's having its highlight, it's having its spotlight, and everyone is talking about it. And this is an issue because when something suddenly becomes popular, everyone's just like, right, how on earth can we make supplements the cheapest? How can we put marketing campaigns and huge amounts behind advertising to get people to buy our product and just, make hay while the sun shines, so to speak. So NAD itself, it's is one of these molecules like spermidine that's received a lot of attention, and it's naturally, again, something that's found in your body. It's found in every single cell. It's incredibly important. It's involved in hundreds of different reactions, but the two things that NAD is most famous for are firstly energy production. So it helps to basically convert the food that you eat into all of the energy that your cells need to function. And it does this in our mitochondria, which are the energy powerhouses of our cells. And the second thing that it's really important for is for repair. So it seems that NAD drives a lot of repair processes in the cell, either directly by fueling them or indirectly by switching on other pathways that activate a lot of cellular maintenance and repair processes in the cells, like autophagy. So as a general rule of thumb, if you have high levels of NAD, you have lots of energy production and lots of repair in your cells, which is good. And if you have low levels of NAD, then repair goes down, energy goes down, you start to accumulate cellular damage, and this sort of manifests as a lot of the signs and symptoms that we experience over our body as the aging process. And the reason that NAD has suddenly became massive in the longevity world is because it's found that your NAD levels decline as you get older. And the decline is actually quite steep. It's estimated a half every 20 years, which is a bit scary considering how important it is for your cellular health. So scientists kind of said, right, if we've got this really important molecule, it's keeping all of these important cellular functions going that keep us aging well, but it declines with age. then why don't we just not let it decline with age? Why don't we try and keep levels topped up, or actually restore levels back to youthful levels? And it was proven a long time ago now that actually, first of all, in cells, then in animals, then in humans, and that you could restore NAD levels. And this had huge benefits across the entire body, all the way through from better cellular health. So we saw improvements in mitochondrial function, repair, things like that. All the way through to whole body health. So improvements in age-related diseases like neurocognitive decline, cardiovascular, things like that. So there was a lot of excitement, and everyone was like, wow, how can we boost NAD? And to begin with, it was just like, let's just do this in any way that we possibly can. Let's put NAD in pills and swallow them and hope it gets to the cells, which it was very soon realized that that didn't work. NAD is a very unstable molecule, and never mind getting through the gut in one piece, it will not survive just being in a tub on a shelf. It's so unstable. So this was realized a long time ago, but you will still find companies selling pills with pure NAD in on Amazon. Even some clinics I've been in, and I've been like, wow, this, you realize that there will be no NAD in this. So that was, a huge red flag. So then the industry was like, okay, so how else can we boost NAD? Well, if the NAD molecule itself is too unstable, then let's just put precursors in these products. So precursors are like the raw materials or the building blocks that are required to make NAD. So there was a huge wave of supplements that contained these precursors. If you follow the NAD space, you will have heard of them. They're called NMN, NR, and again, this was the best thing we knew at the time. If we can't use the full NAD molecule, let's use a precursor. And it was shown that these precursors did go into the cells, and they did actually convert into NAD. When we got into this space, we started looking at all the science and like looking at the data behind these precursors and going, hang on a minute, there's a huge issue here. And that's basically that these precursors are not addressing the reason why NAD declines. So usually when something declines in the body, it's for a reason. And yes, you can just try and top it back up again. But if there's a fundamental issue, meaning that somehow our body's just not making NAD from these precursors anymore, then surely we need to fix that, because otherwise people are spending a huge amount of money taking all the raw materials, but if their body can't turn it into NAD, then that's an issue. And all of the science showed that the main enzyme that basically takes the raw material and turns it into NAD declines with age. So we have a huge market selling these supplements to people that can't really do anything with them in their bodies. So this is where we decided, let's look at the latest science and let's try and develop a supplement that's actually based on the latest science and develop something that actually increases levels of this enzyme in our body, so our bodies can actually use the precursors and make NAD like they did when we were young.
So it's a fantastic product, by the way, and I also keep talking about it, and I get really great feedback, which is why I keep talking about it. But are there, and NMN and NR are more well-known in the space. When I speak about NAD, I tell people, do you know Nuchido? Most people say no, but they know NMN and they know NR. So I'm wondering, what are you seeing in this NAD industry space? Do you have copycats of Nuchido or copycats of NMN and NR, or what's happening? What do people need to know before they jump into trying to boost their NAD levels through a supplement?
I think a lot of the reason why people know a lot about NMN and NR is because the companies behind them are huge and have huge multi-million-dollar marketing budgets. So there's one particular company that owns the patent for NR, and its marketing budget is crazy. It's in the tens of millions. And that is why you hear about it all the time. NMN is, being made popular by particular scientists that talk about it a lot. NMN is now banned. I don't know if many people realize that, but it's banned in the US because it was never actually approved as a supplement. It's one of these things that's had no real testing done on it. It's now being developed as a drug molecule, so it's not allowed to be sold as a supplement.
Can I interrupt you for a second?
Yeah.
Just I want to get it a little bit clearer. So if there's been tens of $millions poured into this, they're not able to patent it though. So why are they doing that? Because there's so many different brands out there.
Oh, you can patent it. NR is patented. Yeah. So it's the production process for NR. It's not the molecule itself, it's the way you manufacture it. So it's a process patent. So the big company that has this patent and has monopolized, the sort of the market, they're constantly fighting off copycats that try to make this molecule in a different way, with different processes that also very alarmingly have been shown to leave residues of toluene, which is a solvent in the supplement. So so yeah, that's a huge issue. NMN, again, it's a huge issue. People are buying it. It's almost a bit like a black market because there's no regulation surrounding it. So anyone can knock it up and sell it, and you've got no idea what you're getting. Again, it's something that's pretty unstable as well. And it's expensive. It's an expensive supplement to buy.
But if it's banned, where are they getting it from? Or it's banned only in the US? I don't know.
Exactly that. Because once it's been banned in the US, then again, we go back to markets that are less well regulated in terms of manufacturing, GMP, good manufacturing practice, in the more Chinese markets, and it's getting brought in, and really nobody knows what is in it, what it's contaminated with, how pure it is. But yeah, there's become this huge demand for it, and if there's a demand, somebody is going to be there and trying to fill that demand at the best price possible, because again, it's expensive, so it's in the company's best interest to try and get a cheaper version.
So you're saying that it's banned to manufacture in the US, but not banned to sell?
No, it's banned to sell. You are not allowed to sell NMN as a supplement in the US, and that is because, well, first of all, it was never approved as a supplement. So to sell something, it has to be approved as a molecule that's basically on specific lists that allow it to be a supplement. NMN was never on those lists, so it was always sold illegally. What happened was a supplement or a raw material supplier wanted to manufacture NMN and legally sell it. So they put forward an application to the FDA to say, we want to actually get this molecule registered as a supplement molecule. And at the same time, a drugs company that was developing a version of NMN as a drug came straight in and said, we're opposing this application because we are developing this molecule as a drug, because the rules according to the FDA and a lot of other jurisdictions are that if something is a drug, it cannot be a supplement, or if something is a supplement, it cannot be a drug. So this was going to be a huge issue to the drugs company if it was allowed as a supplement, because it meant that they could no longer develop it as a drug. So because it's a drug and it's under development as a drug, it cannot be legally sold as a supplement. So it is illegal to be sold or made
and
as
people,
a supplement.
but can't they find it on Amazon anyways? I mean,
yes. So this is it. So people can still get it, but legally it is never been allowed as a supplement.
Crazy. Oh my gosh. So how is somebody supposed to know, is this safe or not safe?
Exactly, because there's no regulations and there's no guidelines or safe upper limits or safe manufacturing practices for raw material suppliers to follow or have to adhere to. So if there's no rules, everyone just does what they want, essentially.
Incredible. So okay, what's happening then? Are in the end, say, are there any Nuchido copycats? People try to do the fixing the factory so we can create our own NAD kind of a thing.
Yeah, there always will be copycats. So the interesting thing is you can still patent. People believe you can't patent supplements. You still can patent supplements in terms of combinations. If you can prove that the combination of different ingredients that you're putting together is novel, you can patent and protect it. So that is exactly the route that we went down. Again, because we want to build a brand where our consumers and our customers are confident that what they're getting is well researched, and we've put the time, money, and effort into protecting it. And we do have people copying us, but at the moment, we are the only company that's done a full human clinical study to actually prove that our supplement is safe and actually does what we say it does. But yeah, you're always going to get copycats, and this is always going to be an issue within the supplement industry, unfortunately. And I think that's where, you know, consumer research, brand credibility, all that sort of thing really has to play a role in educating people about what they're buying, what they should be looking out for, which is, you know, why we're doing this. And that becomes incredibly important.
What are in spermidine, for example, Leslie explained how they wash things out, they use the synthetic versions. And so I would like to know from Leslie and from you, first of all, is any of this sort of washing out, cutting corners, and people trying to copy what you're doing happening to you? And then how do we empower ourselves to figure out what is safe and efficacious so that we can buy it?
Sure. Just to follow on from what Dr. Conlon was saying about these copycats, you can actually find companies in China that they will not only supply you with the synthetic ingredient, they will combine it for you. So somebody in China will say, oh, let's look at Nuchido, right? We'll take this and we'll take that, the synthetic version of every natural thing she has in there, like epigallocatechin from green tea. They can take these things and they put them together. They will encapsulate them. They will bottle them. They will print a label in English. They will even put a little sticker on there with a Union Jack saying exclusive UK supplier or exclusive US supplier, which consumers are looking at the backs of these bottles so quickly. They see the Union Jack or the American flag and they're like, oh, Stars and Stripes is there. This must be okay. Made in the USA. Hooray, right? So it's so easy to not even touch your product, let alone go and inspect the factories. Now, you know, in the case of say spermidine, you know, Primeadine, the gluten-free version, I have been to the fields where we grow our turmeric. I have been to the outdoor purpose-built ponds that where we commission to have our special strain of chlorella grown. I have been to the orchards where we get the Okinawan lime peel. I've met the farmers. I've checked to make sure that there are weeds around, you know, in the soil, which means no pesticides, because that matters to me as a patient. I don't want to put something in me that might not be good for me. Now, so I just want to make that point that it's so easy to get into the supplement business and never visit a factory, never touch the product even, just have it all shipped from China to your Amazon warehouse. And, you know, does Amazon check?
No.
Not really. Now, they've just started to go into the pharmaceutical business. Maybe we'll see some changes there. You know, I know they kicked N-acetylcysteine out of their, you know, their product lines in the US, but
Why?
they really don't check
because
make it's well, no, it's technically it's a drug in the United States. Yeah. Yeah. So it's classified as a drug as opposed to a supplement. So in any event, all of this is just to say that for people like Nichola and I, who really want to take the high road, it's the difference between buying a Birkin bag and a cheap counterfeit that's about to fall apart. Except you're putting that cheap counterfeit into your body and it's being incorporated as part of your cells. So even with spermidine, when you take, let's say people just take wheat germ. Wheat germ is famously unstable, and it's why bakers don't want it in their flour. So they ask millers to get rid of it. Now, if you encapsulate that, it just slowly goes rancid. It's kind of like what Dr. Conlon was saying about having these products of NAD that are on the shelf and they are so unstable that they become, ineffective. Now, with say a wheat germ where you don't defat it, that actually goes rancid. And what do we know about cells? Well, the outer layer of the cells, these are lipids, and you don't want to have a rancid lipid become incorporated in the outer part of your cell, because that is what lets things out and lets good things in. You want to make sure that this cell is strong and the lipid layer is good. So there are just, there are so many reasons why it makes sense to go with good quality as opposed to cheap quantity, but it's not regulated. And as a result, it's cowboys, basically. It's you've got, like I said, people like me and Dr. Conlon who are taking the high road, but you have so many other people who see the opportunity for a quick buck, and they will flip these companies so fast. Some of them are venture capital backed, and they do need to show a profit within that 5 to 8 year timeline that VCs have for them. Having represented companies trying to get VC funding, I know exactly how it works. You got to flip, and you're growing revenues as quickly as you can. But, Dr. Conlon and I are here to really have good projects. This is why I didn't take any VC money.
Yeah, it's incredible. And it's kind of scary. And I would love Dr. Conlon to explain a little bit about what's happening in the US manufacturing industry, because we can easily poo-poo, different countries. And we look at, like you said, we look at it and be fooled that there's an American flag or a Union Jack there and go, oh, it's made in the US, it's safe, without even taking a deeper dive. But Dr. Khan, do you want to, you had some experience because you were looking to manufacture Nuchido in the US, and if it's okay, I'd love for you to share what you saw that's happening there.
Yeah, I think finding a good manufacturer anyway is very, very difficult. When I, went into this industry, I was really naive as to how difficult it would be to find a manufacturer. Visited so many factories where I was absolutely appalled to think that these were actually manufacturing things that people were going to consume, and actually saw some labels of some pretty big, brands of supplements in these warehouses, and thinking, oh my God, like, remind me never ever to consume them, because these places just were quite frankly dirty, and just not good places. So yeah, I think that's one thing. In terms of like finding a manufacturer, the first point is somewhere that's GMP, so good manufacturing practice. These follow ISO guidelines of how everything needs to be done correctly in all the standard operating procedures. Then also finding manufacturers that actually comply to the regulations set out by the country. So for example, like if we want to manufacture and sell in the US, then we have to use FDA approved manufacturing sites, which you'd think there would be plenty of, but they're not.
Yeah.
They're few and far between. So really you've got to try and tick all these boxes. But actually I think aside from just the process of manufacturing, I think the issues that we have in terms of where people are really cutting corners is like Leslie said, it's speed. It's speed to just get things out. And the bit that takes the biggest amount of time is testing. And that is a huge issue within the supplement market, because there is no legal requirement for a company to actually test their product to prove it actually works, which many people don't realize. A lot of people that go into a store and go and buy a supplement think, oh, well, I must have been testing done on this. It's got all these claims on the back of the label. And actually, most companies don't do testing. So I would always say, like, when people are looking to get a supplement, check there's been some human testing or any testing as it goes. Also, look at the dosages. Another way that companies really cut corners is there will be human trials that may have been done at a particular dosage, and then when you actually look at the bottle, and it'll say, tested in humans, proven to do this, and then it'll use like a tenth of the actual dose that was used in the study. And then the consumer will be like, great, 1 pill a day and take it. And it's like, that is a tenth of what is actually required to make it work. And this is actually a problem with some of the NAD supplements like NR. So in their studies and many of their clinical trials, they use up to 1,000 milligrams. Yet if you look at the dose on the bottles, it's 300. So there's a huge difference between what they're telling their customers to take versus what is used in the majority of their clinical trials.
I remember, yes, exactly. When I first interviewed both of you, you had looked at the research and you say the dosage on the bottle is what is researched in science and in your trials. So I think it makes perfect sense. So we talked about ingredients that can be bunk and not actually good, the synthetic or not there, because you hear all these stories about the FDA going in and removing all these supplements off the shelves because it doesn't contain what's in the bottle or doesn't contain the amount that's in there. So we want to know about the amount of the ingredient that's in there to be efficacious. And we want to make sure we have good manufacturing processes. So that's why you guys go to the factory, you go to the fields, you go make sure this is done. And I'm just afraid that you guys are such a small percentage of the people that actually do this work. And this is why I constantly talk about you. And you have integrity, and that matters. And I can't do that with every single person, but if anybody approaches me and wants me to talk about something, I really do the hard work and look into it because it matters to me too. And I'm not the expert like you, but I do want to empower women as much as I can to know what to look out for. So in terms of looking for the GMP sticker is important. And does that get copied? Can that be fake sometimes? And it just says that, and we don't really know.
And this is a huge issue, is that no one's really regulating the industry. And I think in terms of the sort of time and effort put in by like the FDA or the EFSA, which regulates European food standard claims, is just minor, that they're almost fighting a losing battle. But I think one of the main issues that we have is just generally the way that the supplement industry is set up to fail. So for example, in Europe, which works very different to the US, the way that you can make a claim about your product is basically there are a set of standard claims that EFSA has decided are approved claims. So for example, if you have a small amount of vitamin C in your product, I can't remember how much it is, but say it's like 50 milligrams is like the amount. If you have 50 milligrams of vitamin C in your product, there are a list of claims attached to that specific ingredient, which you are then allowed to make. So for example, you can then say, this may help to improve immune function. And it's these very specific words. And you cannot make any of the claims, even if you have the research to prove them, because they're not approved claims. So this is like, well, why is any company going to invest the time and money and effort in actually going to the length of doing a clinical trial to be able to prove something if it's not one of the EFSA approved claims, and then they can never say it? So this is kind of, it's like the system is set up to fail. It's like nobody's going to invest money, apart from us, because we want to show it's scientifically proven. But yeah, and this is a huge issue. It's set up to fail. The regulation is very, very poor. So I think this is where we need to just take steps to educate consumers about what really goes on.
And I think also with the GMP and ISO standards, there's a difference between, say, ISO 9001, which literally can mean that your procedures, your standard operating procedures, are stored in a binder, in somebody's office, and that you say you self certify that you always follow these standard operating procedures versus, say, ISO 22000 standards, which are much more rigorous around food safety, where they make sure that there's no rat poison that's close to where they're encapsulating, that there is no toxic, there's not a gas station nearby where fumes might be a pollutant or any kind of liquid contaminant. So there are these different quality standards consumers can't know, right? Just think how long it took us to educate people around what high fructose corn syrup was. Like, that's been in the market for decades. Or hydrogenated fats, right? We're only getting rid of those in the United States. And yet I remember when I was, in 1970, when I was a little girl, I remember my grandfather slathering the latest margarine on because his doctor told him, don't eat butter. He'd been a Midwestern farm boy. Don't eat butter. Have this new fancy, hydrogenated margarine. It's the best thing for you. Corn oil, right? And it took forever to educate people on that, right? Like 50 years, more than 50 years. And that hydrogenated oil is actually still in the supplement industry even.
It is. It's scary. So I have to let you girls go now. I have more questions and we didn't get to them, so maybe we'll do a part 2, but let's leave the listener with some tools. What can she do to empower herself to make a better decision with supplements? Either one can start, whoever's ready.
I think first of all, I think one thing to adopt as a mindset is that, when it comes to health, we're taught that only drugs can possibly do anything for us. And certainly when I switched from the drugs industry to supplements, I had a lot of comments like, wow, you're throwing away your credible career. And, why would you go and start a supplement company? Because supplements don't work. They don't do anything. Actually, your body has no idea what is a drug molecule, what is a supplement molecule, what is a nutrient out of food. They all have a powerful physiological effect. So I think a first thing just to understand is that actually supplements can have a major impact on your health. As myself and Leslie both know from customer feedback and knowing how we have I'm sure you're the same, of a lot of customers who've been through, and like your own journey, Leslie, have tried all sorts of drugs and things, and then actually it's been the supplements and nutrients, the lifestyle that has really helped. So I think if a first thing just as a takeaway from me is that supplements really do help. The second thing would obviously be, really do your research. It is time consuming, but if you get it right, it can have a major impact. And, you don't want to be taking endless amounts of supplements where you really don't know if they're working or what they've got in them. Or, do you even need them? Just because an influencer takes a particular supplement doesn't mean that you necessarily need it. Everyone's biology is unique. So you need to think about your specific health concerns, whether that is doing some blood work, looking for deficiencies, any particular symptoms that you may have, and then trying to, research about particular supplements that may help. Always make sure there's a purpose behind what supplement you're taking, and don't just blindly take things because you've heard somewhere that, oh yeah, this one might be good for me. I think is really important. Also, think about the difference when we're talking about women. A lot of things that have been researched in medical research have been researched on men, not women. And women have very different needs. So look at, who have the studies been done on? Is there any particular research in women? Is the dosage different? Is there an alternative? So those would probably be my takeaways.
Thank you.
And
Leslie, yeah.
As the non-scientist here, but as somebody who's more on the commercial side, I would look very carefully at the ingredients list, look for the synthetic materials, because those really do cost pennies in China.
How do you know synthetic? That's because on the bottle, spermidine is spermidine. They don't say synthetic, do they?
Usually it'll say, if it's food derived, it will say food derived spermidine, or if it's not, it will say spermidine HCl, which is hydrochloride, or TCl, tetrahydrochloride. Obviously, if you look at a product like Nuchido, you know, we already talked about the perils of NMN and NR and some of these other precursor products, right? Which I've noticed that some of them will say pure NAD, the purest, like, oh, well, that must be better. Well, yeah, pure
with
cyanide.
a halo around it.
Yeah, I mean, just because cyanide is 100% pure does not mean that it's good for you, right? So it does give this false halo effect using the word pure. I would also look at some of the other materials. So if there's magnesium stearate in the ingredients list, then we know right away that they're using very fast encapsulating, fully automatized production lines. Why does that matter? Well, that means that they're just going to get this through the manufacturing process really fast. And magnesium stearate does not actually have any benefit to your body. It's actually more than 70 to 75% of all magnesium stearate used in the supplement industry is that hydrogenated oil that I talked about earlier that is supposed to be out of the American food supply by 2025, but supplements are exempt. Interesting, right? And why it's used in the supplement encapsulation industry is that it helps the ingredients flow more smoothly through the machinery. So it goes fast. Now with my product and Nichola's as well, I'm guessing you've got to go more slowly to encapsulate. If the ingredients get stuck, then you actually need a human to go in, lift up the lid, put a giant spoon in there, move it around and unblock it to get the ingredients moving again. As a patient, I object to having ingredients in a product that have no benefit to me, but have only benefit to, say, the manufacturing process. Why? Especially if there is a harm involved. And I don't want hydrogenated oil going into me, becoming part of that lipid layer of the cell, right? So I would look for that because that is a very quick clue. Are these people really just trying to do this as cheaply as possible?
And this is a good point, actually. So the ingredients that are added for the manufacturing process. So yeah, magnesium stearate, it's a flow agent. We've had issues where, we will have manufacturers that will not manufacture without it. Like they want it, even, if you say, well, we don't want to add it, they're like, well, you can't work with us. We've had this issue with multiple manufacturers where they're just like, these ingredients will not run on our machines and our lines. It's too much of a headache. So we're not going to work with you. You can get natural alternatives, things like rice bran, things like that can be used as a flow agent, but it's way more expensive. So a lot of companies will be like, oh, so they're telling me they won't work with me. Here's a natural alternative. It's going to like triple the price. Well, just, stick magnesium stearate in. Yeah.
Most people don't know. But you now know. And I went to check all my bottles for magnesium stearate after I heard that. And yes, it's not a problem, I guess, if you're taking one capsule, but you're taking multiple capsules and it's the, death by 1,000 cuts theory. You just don't want to keep putting that in your body. And so I really want to, I hope every woman goes now and checks all her bottles. So I am so grateful that you're here. I would love to do a part 2 because I still have loaded questions, but I think you've given us some tools. The awareness is the biggest thing. Now, the hard work is what we have to do. And I'm sorry, you just have to do it. Even things that I share, not, of course, Primeadine and Nuchido, I'm full confidence, but sometimes I'll share something in my story and it's a supplement I picked up. I was in Vietnam. It was the only thing I could find. I didn't do all the deep work. So don't think just because I'm an influencer or anyone else, like everything's perfect and I've done all the work and checked. Always remain skeptical, really always. I beg you to do your work, and I beg you to do the work looking into Primeadine and Nuchido, because you will find that it's actually super safe and it's effective. And that's why I'm so happy to talk about them too. So before I let you go, are there any last words that you guys want to share? You've shared so much, but I don't know if there's any events or things or products coming out in the pipeline that we should know about.
I would just say that that Nuchido and Primeadine go really well together, actually.
Yeah.
And we have a number of customers who take both
Mm.
and get good results that way. And then I also would love to do 2 plugs, one for the Health Optimization Summit that Tim Gray is throwing in June, mid-June, and also for the Oxford Longevity Project's annual Smart Aging Summit in Oxford at St. Hilda's College, University of Oxford, end of June, where Zora will be as well.
Yay. I can't wait. Are there
Yeah.
any, if anybody's listening, I know there are discount codes for the Human Optimization Summit. I'm just digging them out, and maybe when I record the intro, I'll find one for you because I'm looking for one myself. So I'll put that out there for you guys. Don't pay full price. There's discounts. Dr. Nichola, any last words or events or things we should know about?
Yeah, I think myself and Leslie are both speaking at the Health Optimization Summit, so I'm pretty sure we'll have some sort of code that we can probably give you. But yeah, no, I think it's we've recently had our paper published for our human clinical trial, which we're incredibly proud of because it's been a huge amount of work and stress and money. But we got that published in a really credible journal. It's a Nature publication journal called Aging, and it's really unusual to get a supplement published in a journal of such high academic quality. So yes, that's something we've just recently had. So yeah, we're proud of that.
Congratulations. Oh, you got to send me the study, and well,
Of course.
we should probably have another recording talking about the results because now I have questions about that study. But thank you so much, ladies, for joining me and clearing the confusion, bringing the awareness, and giving us some tools on how to make the best choices when it comes to supplements. So I hope you have a wonderful day, and you guys are always welcome to come back.
Thanks, Zora.
Thank you.